Go ahead.
I just had one. Can you discuss any measures that the president's doctors may be taking to try to lower the risk of long COVID when the president, and the reason I asked it is obviously I know he's up to it, or he's feeling up to it now, but there's anecdotal data to suggest that, taking it easy, not exercising might be one way to perhaps lower the risks.
Well, one thing I would say is that, and you heard Dr. Jha say this as well, because the president's symptoms have been very mild, and as we saw from Dr. O'Connor's letter, he asked last night to exercise. We are pretty confident that we will continue to see the president to continue to recover from this. Look, the thing to remember, and you've heard us say this over and over again. Dr. O'Connor said this in his letter. You've heard Dr. Jha say this as well. Is because the president is fully vaccinated, double boosted, and has the treatment of Paxlovid, which is, we see this as a teachable moment. You've heard us say for the American public. Who else can they, for those who have not been vaccinated or have not gotten their booster yet, learn from than the President of the United States of how important it is to get those free vaccines, to get those free booster, and to be able to get Paxlovid and to protect and to get that extra protection. And so, again, there's a reason why he's having very mild symptoms. It's because of the work that he has been able to do, and we are pretty confident that he will continue, to get better.
On monkeypox, is the administration encouraging all Americans to get vaccinated? I guess, what's the guidance?
So our guidance is, first, we've had a comprehensive and aggressive response to this. That's what we deployed. We rolled out that strategy last month in June. And so once we realized that it was what was happening, the cases that we were seeing, there were more than 300,000 vaccines across the country in a matter of weeks. And we quickly ordered the production of 5 million more vaccine when we saw that the virus was starting to spread. What we are telling people is to make sure that, HHS has also made available testing, which is really important in this process. But we are also telling folks that if you have concerns or if you want to know what your personal protocol should be, that you should go to your provider, your medical provider, have that conversation with your medical provider, or also reach out to the local health agency in your state or city.
It's not just saying everybody should get vaccinated. It's go to your doctor and talk about it.
The best person or place to go to is your medical provider and have that conversation to see if it is if it is beneficial to you to get vaccinated.
And then is the White House